Hi everyone, this is Rae Anne. I'm here today with Eve Easton, a registered nurse at Mount Sinai's Palliative Care. And Eve, welcome. It's a pleasure to be here with you today.
Thank you. It's a pleasure to see you, and thanks for asking me.
Eve and I have known each other for 4 years now. Eve worked with me as my registered nurse as I was receiving palliative care services at Mount Sinai, as I was recovering from stage 4 head and neck cancer. So I know firsthand how valuable these services that you provide are, and thank you.
Oh, you're welcome.
So we're here today to talk about palliative care and all of its benefits, and really just to start at the beginning. When someone's being treated for a serious illness, whether it be cancer or some other serious illness, talk to me a little bit about what palliative care does.
So not only do we help manage symptoms that are related to the disease and the treatment, the physical symptoms, and providing emotional support for the patient. One of the nice things that we help to do is to clarify the diagnosis of the patient, the prognosis, the goals and the options, treatment options for the patient, so that the patient's goals align with the treatments that are being offered. It helps people to understand their illness better, I think, and enable them to make the decisions that are right for them. And that doesn't mean ending treatment or that. It just means supporting people to make the right decisions for them and their families, because their families are part of that decision making, and to know that they're supported throughout their treatment and the decisions that they make at the time. And decisions can change and goals can change over the time. And it's always, the conversation evolves all the time, depending what's going on with the patient.
That's great. That's great. So what I'm hearing is that you're able to guide the patients through the decision-making process throughout their time with you.
Yeah, I think we create an environment that allows people to freely to speak about what's going on. Sometimes patients are very scared about sharing their fears with their oncologists, fear of letting them down if they decide that they physically, don't want to continue a particular line of treatment, and their direction wants to be focused more on maybe symptom management and the quality of life. We can help with those conversations. One of the nice things that we do as a team is we write those questions down for the patient, and then we share them with their oncologist. So the patient has a copy, the oncologist has a copy. So there's already some preparation for that conversation to happen for the patient. So I think it's good, the communication and the understanding of what the patient wants and desires is one of the most important things.
What is the appropriate time to be referred to palliative care?
So palliative care has been shown to have many benefits for patients, but earlier intervention is more beneficial. So I think I work particularly with cancer patients. So the earlier into somebody's diagnosis, the better outcomes and improvements in quality of life for those patients that receive concurrent palliative care.
Who refers someone to palliative care?
So in our setting, it's the oncology teams that tend to refer their patients to us. For us, they have to be known and be receiving treatment at the cancer center. But we actually also get some self-referrals from patients. And normally that's due to personal experience of a family member, friend or loved one that's had palliative care in the past. So they've known the benefits of having palliative care as part of their team. So they just self-refer. And I think for some people, that are very tech savvy and knowledgeable about their treatment options, Some of them explore online, and I know that we've had some patients that have looked up providers, on the getpalliativecare.org website. So that's a great resource for patients, because even if they're not coming to our treatment center, they can look locally to find somebody that can provide them with palliative care.
And how is it different from my existing treatment? If I was receiving cancer care, if I was getting radiation and chemotherapy, what's the difference?
So the difference is that we're experts in symptom management and communication and helping patients understand their illness and treatments. So we work alongside patients getting curative or palliative treatment to provide an extra level of support. Now, for some people, that's the emotional aspect of dealing with a serious illness. And for some people, a lot of the time, the physical symptoms that come with their disease or their treatments, we help to manage those. There's a high symptom burden, particularly for our patients, and the volume of patients that the oncology teams have, it's a lot for them to deal with at times. So not only do we take care of the patients and their families, we're also helping the oncology teams as well.
The patient will then be able to stay connected with their team of oncologists and radiologists throughout treatment.
Oh, definitely. That's the nice thing about palliative care, is that it goes side by side with whatever treatment that a patient is having. So they benefit from all the knowledge and expertise of their oncologists, and then you get the knowledge and expertise and additional support from our team.
Great. Is there communication between the two teams?
I think that's one of the nice things about what we offer to a patient, is the communication between the teams. Sometimes the patients find it very difficult to ask certain questions about treatments or their prognosis, and we can help formulate those questions for a patient so they can have an open discussion with the oncology team. And then sometimes, there's miscommunication between the patient and the team, so we help clarify that for them as well. So I think it's nice for us because we get the best of both worlds. We get to sort of bridge the patient and their team sometimes in difficult circumstances.
Oh, that's amazing. That's really great.
Yeah.
Who makes up the palliative care team? What kind of practitioners are on there?
So for our team at Mount Sinai, we have physicians, we have nurse practitioners who independently see patients, and then we have the coordinators, which are the registered nurses. Since we're embedded in the cancer center, our particular practice, we don't have our own social workers or chaplains, so we use those that are based at the cancer center. So that even means even more collaboration with the teams, because we're using a social worker that is known to the patients and the oncology teams.
Let's talk about the family connection and what palliative care can offer those individuals who are caregivers to the patient.
So I think, as you can probably appreciate, there's a lot of burden sometimes on patients' families and the expectations of suddenly being a caregiver and dealing with an illness when they've had no experience of that before. So one of the nice things that we do is provide the emotional support to the family. And we do a lot of education so that they can manage the patient's symptoms when they're at home. They don't have to panic and think about, I have to call 911 because somebody's in pain or they won't stop vomiting, whatever it is. So we make ourselves available as much to the family and the caregiver as we do to the patients, because it's such a difficult time for some people,
Right. So when you say available, then by phone or email, whatever the hospital has set up as far as communication, that's all accessible?
Yes, so we do a lot of check-in phone calls for our patients during the week, and also now that we use MyChart a lot for our patients. So if they have a quick question, they can send us a question, and one of us will respond to them. And then, as I said, sometimes we set up telephone appointments with the patient's families just to check in. And then we also collaborate really well with the social worker and refer to the chaplain as needed as well. So yeah, they're just as important as what's actually going on with the patient, I think, because if they get burnt out and are exhausted, then that then affects how the patient's doing at home as well.
That's a great point. That's a really good point. Okay, let me ask you, who pays for palliative care?
So most insurances, it's covered, so people don't have to worry about that. I think that's one of the fears given the hospital system and insurance and stuff like that, but it's covered.
That's great. That's great. And then how long is the patient eligible for palliative care?
It's ongoing. There's no set time for it. For some of our patients, they have curative treatment. So we will follow them for the duration of their particular course of treatment, given the symptom burden. And then as they are titrated off certain medications and things and are not coming in as frequently, they can choose to see us as needed. And then for other people, we will see them all the way through their treatment. And even if they go into hospital, we're fortunate that we have the inpatient team. So there's a lot of collaboration between our inpatient team if somebody happens to get admitted as well.
During COVID, I was wondering if you are seeing patients differently and have your services changed?
So our services have remained available to our patients at all times. Obviously, we did have to make some changes. One of the good things was that we were able to switch the majority of our patients to telehealth. Most of that was via video visits. Some patients don't have smartphones, so we accommodated that by doing phone visits for them. And other patients, just given the nature of their symptoms and stuff, they would have to come in to be seen in person. But there were safety precautions put in place for all of the patients. Most patients continued to have their treatment throughout COVID. And we remained available the whole time. I mean, we had, some of our team got allocated to other areas, which is understandable given what was happening. But we adapted very quickly. I think within a week of, the the pandemic happening, we had switched, I would say, about 90% of our patients over to telehealth. So I think we did a great job. None of our patients missed out. There were some frustrations with accessibility to medications, given, what was going on in the country at the time, but we are resilient, if not anything else. And I don't think many of our patients even got admitted during that time. So we were very fortunate, and I can't speak on behalf of our patients, but we managed to keep them safe and their symptoms managed and the support still in place. So I think we did a good job.
That's amazing. As a nurse, working with palliative care patients, what do you wish every patient knew walking into your door for the first time?
Well, it may, or I don't think when we first met, I wasn't sure if you were told about the referral or what we actually did. And I think that's one of the things that I would love is for people to actually understand what palliative care is and not have a fear about palliative care, that your quality of life will improve with having palliative care as part of your team, and that what we can offer as a team to a patient. So I think that's one of my goals, because it's not only patients, it's also colleagues that don't understand who we are and what we do, which surprises me in this day and age. A lot of my colleagues that I've sat next to in clinic for years still refer to us as pain management. And, we're obviously so much more than that. So I would just like to educate people not to be fearful of palliative care, that palliative care is a great addition to their team, they benefit, their team benefits, and, you know, the quality of life improves greatly when we're part of their team. So that would be my wish.
Absolutely. From speaking from experience, it was absolutely the bridge that I took from treatment back to everyday life. From symptom management to coming off some of the medications that I was taking during treatment, it was 100% the bridge between then and now.
Yeah.
So thank you.
That's, you know, I'm glad we did a good job.
You did. You did.